If your feet burn at night and you cannot figure out why. If you have started dropping things because your hands feel numb. If you stumble for no clear reason and your doctor simply tells you that is just aging, I want you to stay with me. What I am about to share could explain exactly why your nerves are deteriorating, and more importantly, what you can do to stop it before the damage becomes permanent. This is not about managing pain with another prescription. This is about protecting what you still have while you are still able to protect it. By the end of this, you will understand the single most damaging substance attacking your nervous system right now, something you are likely exposed to every single day, and you will know exactly what to change today, not at some point in the future. Today. My name is Dr. Victor Hayes. I have spent years treating patients with neuropathy. And what frustrates me most is this. The majority of people receive the wrong explanation for why their nerves are failing. They are told it is diabetes. They are told it is genetics. They are told it is simply a consequence of age. In most cases, none of that is the full story. The real cause is something they encounter daily, something they believe is harmless, something that is quietly destroying their nerve cells from the inside. Let me ask you something. Have you felt numbness or burning in your feet or hands? Here's a fact that most people are never told. By the time you feel those symptoms, up to 70% of your nerve fibers may already be damaged. Once nerve loss crosses a certain threshold, recovery becomes extremely limited. Let me tell you about a patient. We will call her Margaret. She was 62 years old, a retired teacher, walked every morning. Then her feet started burning at night, badly enough to wake her from sleep. Her hands went numb while holding a cup of coffee. She began stumbling on flat ground as though her legs had forgotten how to function. Her doctors attributed it to age-related circulation changes and possibly a pinched nerve. When we looked deeper, we found something different. A daily exposure she believed was healthy was damaging her nervous system. Once we identified and removed it, the damage did not reverse overnight, but it stopped progressing. That alone changed the trajectory of her life. So what is this substance, and how many people are unknowingly feeding it to their nerves every single day? To understand why, you need to understand how nerves actually work. Your nerves are not like muscles that recover quickly from stress. They are not like skin that heals within days. Nerve cells are highly specialized structures that require constant oxygen, precise nutrition, and stable blood sugar to survive, and they repair themselves extremely slowly. That means damage accumulates quietly, long before any symptoms appear. By the time you notice something is wrong, the process has often been underway for years. The nerves in your feet and hands are among the longest cells in the human body. Some extend over 3 feet from your spinal cord to your toes. That is a considerable distance for a single cell to maintain. They depend on a continuous supply of nutrients delivered through very small blood vessels. When those vessels become damaged, when circulation drops, when toxic compounds accumulate, nerve cells begin to starve. Because this happens gradually, most people do not notice until significant damage has already occurred. Now here is the part that makes people uncomfortable. The worst substance destroying your nerves is not lead or mercury. It is not even alcohol alone. The most damaging compound is chronically elevated blood sugar and the toxic byproducts it generates inside your body. Here is the critical point. You do not need a diabetes diagnosis for elevated blood sugar to damage your nerves. You only need prolonged glucose elevation, what is commonly called insulin resistance or pre-diabetes. Millions of people over 45 have this condition and are entirely unaware of it. When blood sugar remains elevated, glucose begins to attach to proteins in your nerve tissue. This creates toxic compounds called advanced glycation end products, or AGEs. These compounds trigger inflammation, degrade the protective coating surrounding nerve fibers, and constrict the blood vessels responsible for feeding nerve cells. Over time, your nerves gradually lose their ability to transmit signals properly. That is when tingling begins, then numbness, then burning pain, then loss of balance. then progressive sensation loss that allows injuries to go unnoticed until infection sets in. One of the most persistent myths about neuropathy is that it appears suddenly. It does not. It develops silently over years, while elevated blood sugar continues producing more ages, more inflammation, and more nerve cell death. The hidden reality is this. Have you ever been told your blood sugar is slightly elevated, that your A1C is 5.8 or 6.1, but not high enough to be called diabetes yet? That is frequently where nerve damage begins. Research shows that prediabetes causes neuropathy at rates nearly comparable to full diabetes. The difference is that most people with prediabetes have never been properly warned. They continue eating and living in ways that keep blood sugar chronically elevated, and their nerves pay the price over time. Now, you may be thinking, but I do not eat sugar. I avoid desserts. I hear that from patients regularly, and I believe them. That is exactly the problem. This substance does not announce itself. It hides in foods most people consider healthy. It hides in eating patterns most people consider harmless. Here is how the damage happens step by step. You eat something that raises blood sugar quickly. Bread, cereal, pasta, white rice, crackers, juice, or fruit consumed on its own. Your body releases insulin to bring glucose levels back down. Over time, your cells become less responsive to insulin. They stop reacting efficiently. Your pancreas produces increasing amounts of insulin trying to compensate, but glucose remains in your bloodstream for longer periods because insulin is no longer working as effectively as it should. Your nerves are exposed to damaging glucose levels repeatedly, meal after meal, day after day, year after year. The blood vessels supplying your nerves sustain damage. Oxygen delivery decreases. Nerves slowly begin to starve. The longest nerves, the ones reaching your feet, suffer first because they are the farthest from your heart. And because this progression is gradual, people rarely connect the cause to the symptoms until significant deterioration has already occurred. Now let us look at where this comes from in everyday life. Breakfast foods consumed without protein or fat, cereal with low-fat milk, toast with jam, a banana on its own, oatmeal with brown sugar, orange juice. These enter your bloodstream rapidly because there is nothing present to slow absorption. The result is a sharp blood sugar spike that directly stresses nerve tissue. These foods are frequently promoted as heart-healthy choices, particularly for people over 50. In reality, when consumed this way, they are among the fastest routes to progressive nerve damage. Liquid sugars are another major source. Fruit juice, smoothies, sweetened coffee beverages, sports drinks. These reach your bloodstream faster than solid food, producing large insulin spikes within minutes. Many people drink orange juice at breakfast under the impression that it is beneficial. From a nerve health perspective, liquid sugars are among the most damaging things you can consume regularly. Hidden sugars in foods marketed as healthy are also a significant issue. Flavored yogurt, granola, protein bars, dried fruit. Many of these contain between 20 and 40 grams of sugar per serving, comparable to candy, but they carry health food branding that obscures that reality. And there is another factor worth noting. Certain medications can quietly deplete nutrients essential for nerve health. Acid-blocking drugs, metformin, and some blood pressure medications can reduce B12 levels over time. B12 is essential for maintaining the protective coating around nerve fibers. If you have been on any of these medications long-term and are developing symptoms, B12 deficiency should be evaluated without delay. Let me tell you about another patient. We will call him Richard. He had experienced burning feet and numb hands for 3 years. His doctors attributed it to aging and circulation. His A1C was 6.3, pre-diabetic. His fasting blood sugar was mildly elevated, but not alarming. What no one had checked was his B12, which turned out to be severely deficient. The cause was a medication he had taken for acid reflux for 8 years. It had been gradually depleting his B12 while his blood sugar crept higher in parallel. We corrected his B12 deficiency and modified his dietary patterns. His nerve damage stopped progressing, the burning diminished, and his balance improved. Identifying both factors made all the difference. Neuropathy is rarely caused by a single factor. It is typically a combination: chronically elevated blood sugar, nutrient deficiencies, inflammation from processed foods, and insufficient physical movement. But elevated blood sugar is the accelerant. It is the element that drives the entire process forward. Your nerves have a tipping point. Early damage produces occasional tingling. As damage advances, symptoms become constant: burning, complete sensation loss, muscle weakness, and eventually life-threatening complications, such as unnoticed foot injuries that lead to serious infection. Once nerve cells die, they rarely recover. That is why removing the damaging factor as early as possible is so important. Here is what I want to be very clear about. Neuropathy is not always reversible, but in many cases it is absolutely preventable from getting worse. And stopping further deterioration alone can preserve your ability to walk independently, feel the ground beneath your feet, maintain your balance, and live without constant pain. So, if chronically elevated blood sugar is the primary damaging agent, what protects against it? What can you realistically do as someone over 45 who wants to maintain their independence and quality of life? Let us talk about that. Here is the single most important principle I teach, and most people have never encountered it. Never eat carbohydrates alone. Not fruit, not bread, not crackers, not cereal, not rice, not pasta. When carbohydrates are consumed by themselves, they enter your bloodstream too rapidly. Blood sugar rises sharply. Insulin surges. The conditions for nerve repair shut down. But when carbohydrates are eaten alongside protein or healthy fat, absorption slows considerably. Blood sugar rises gradually. The insulin response is moderate. Your nerves are not subjected to damaging spikes. The same food that harms your nerves when eaten alone becomes significantly safer when paired correctly. An apple eaten alone at mid-afternoon will spike your blood sugar within 30 minutes. That same apple eaten with a handful of almonds or a piece of cheese produces an entirely different metabolic response: slower absorption, steadier glucose, less nerve stress. This principle alone explains why some people develop severe neuropathy, while others in similar circumstances do not. It is often not just what you eat, it is how you eat it. Let me tell you about Carol. She was 58 years old and came to see me because her feet burned so severely she could not sleep. Her fingers felt numb while typing. She had stumbled twice in a single month. She believed she was eating well: oatmeal with raisins and honey for breakfast, a banana mid-morning, a turkey sandwich with an apple for lunch, brown rice at dinner. Every single one of those meals was spiking her blood sugar because she was consistently eating carbohydrates without adequate protein or fat to slow absorption. We removed the raisins and honey, added walnuts and protein to her oatmeal, moved her banana to after lunch paired with almond butter, reduced the bread at lunch and added avocado and cheese, cut her rice portion in half and paired it with salmon, olive oil, and vegetables. Within 4 weeks, her nighttime burning had decreased by roughly 60%. Within 8 weeks, her balance had improved noticeably. Within 12 weeks, sensation had partially returned to her fingertips. The primary change was simply stopping the repeated blood sugar spikes that had been damaging her nervous system multiple times every day. Here is the complete framework in 7 steps. Step 1. Pair every carbohydrate with protein or fat. Before eating any carb, ask yourself where the protein or fat is. If you cannot answer that question, do not eat it yet. Add something first. Even a tablespoon of nut butter changes the metabolic outcome significantly. Step 2. Manage your portions. Even well-paired carbohydrates can cause blood sugar problems if consumed in large quantities. Keep carbohydrate portions to approximately half a cup to 1 cup per meal, roughly the size of your closed fist. Step 3. Extend your overnight fasting window to 12 hours. Finish dinner by 7 in the evening and do not eat until 7 in the morning. This gives your body an extended period of low insulin and low blood sugar, during which nerve repair processes become more active. Your nerves need this window. Step 4. Protect your nerves with essential nutrients. Your nerves require B12 for their protective myelin coating. Many adults over 50 are deficient. particularly those taking acid-blocking medications or metformin. Additional nutrients that support nerve health include B6, folate, alpha-lipoic acid, magnesium, omega-3 fatty acids from fish oil, and vitamin D. These do not reverse existing damage, but they help protect what remains and support the conditions needed for stabilization. Step 5. Do not oversupplement. More is not better. High-dose B6 above 100 milligrams daily can actually worsen nerve damage over time. Get your levels tested and supplement strategically based on actual deficiencies, not assumptions. Step 6. Reduce dietary inflammation. Processed seed oils, fried foods, refined grains, and added sugars all promote the inflammation that accelerates nerve damage. Wild-caught fish, olive oil, avocados, nuts, and leafy green vegetables help calm that inflammation. Less systemic inflammation means less nerve irritation, less pain, and better conditions for healing. Step 7. Move gently every day. You do not need intense exercise. Walking for 10 to 15 minutes after meals is one of the most effective tools available for managing blood sugar. Movement helps move glucose out of your bloodstream and into your muscles, reducing the duration of elevated blood sugar after eating. Movement is genuinely one of the most accessible forms of medicine available to you. Many people feel discouraged when they learn that nerve damage is difficult to reverse. That is an understandable response. Nerves do regenerate slowly, and in some cases the damage is not fully reversible. But stopping progression is equally powerful. Walking without assistance, sleeping through the night, maintaining balance so you do not fall, retaining enough sensation to notice a cut before it becomes infected. These outcomes matter enormously. The belief that nothing can be done is one of the most harmful ideas in neuropathy care, because that belief leads directly to inaction, and inaction allows the damage to continue. Neuropathy is also not simply about uncomfortable feet. It is about independence, the ability to walk, stand, and move through daily life without fear of falling. As neuropathy progresses, fall risk increases substantially. Falls are one of the most serious threats facing older adults. A hip fracture at 70 can mean permanent loss of mobility. An unnoticed wound on a numb foot can lead to infection and serious consequences. The timing of intervention matters. Early-stage damage responds far better than advanced damage. Tingling and numbness are warning signals, not final verdicts. They are your nervous system telling you that something needs to change now, before permanent damage is established. Here is a straightforward 2-week challenge to help you take control. Remove all liquid sugars immediately. No juice, no soda, no sweetened beverages of any kind. Pair every carbohydrate with protein or fat without exception. No fruit alone, no bread alone. Eat breakfast with at least 20 grams of protein. Eggs, Greek yogurt, or a quality protein source. Walk for 10 to 15 minutes after dinner every night. If you have not had your A1C and B12 levels checked recently, request those tests at your next appointment. Stop eating 12 hours before breakfast. Dinner at 7, breakfast at 7. Pay attention to your symptoms and write them down. Many people notice reduced burning, improved sensation, better balance, and deeper sleep within 2 to 4 weeks of consistent changes. Even small improvements are meaningful. They tell you that the damage is not yet fixed in place and that your nervous system still has capacity to stabilize. Let me close with something important. Anyone claiming a complete cure for neuropathy in a short time frame is not being honest with you. Dead nerve cells do not regenerate easily. Advanced damage cannot always be reversed. But anyone telling you that nothing can be done is equally wrong. The truth lives between those two positions. That is where real, meaningful progress is possible. Neuropathy typically results from years of quiet, cumulative damage. It is reasonable that improvement takes time. But stopping the damaging process is always the essential first step. You cannot begin to heal what you are still actively harming every single day. If this was useful to you, share it with someone over 45 who is dealing with unexplained numbness, tingling, or burning, and has been told to simply manage it. Your nerves are not replaceable. Protect them while you still have the opportunity to do so. I am Dr. Victor Hayes, and I will see you in the next one.